together and really talk about and give us a real overview and insight of what resource therapy is.
Thank you very much. I'm really happy to be here.
Great. Can you tell us a little bit more about resource therapy?
Resource therapy is a parts therapy, and it's a bit like ego state therapy, although there's no need for hypnosis with resource therapy. It divides the personality into different, part of me might want to do one thing, another part might want to do something else, and where a person might have a part that is pathological, and that person would have several other parts that aren't pathological. They might, for example, be OCD and have a need to check locks and taps in one part, and other parts of the personality wouldn't have a need to do that at all, and might even be embarrassed about those actions. Or a person might have a gambling part that gambles, and other parts that wishes that part didn't gamble. So what resource therapy enables is a therapist to get the right part out that needs the work, rather than talking to an intellectual part that comes into therapy saying there's something wrong. It's much more important to talk to the part that needs a change rather than the part that knows I want change.
And it sounded really sort of powerful type of therapy that has sort of been able to change a lot of people's lives. So how does it differ from cognitive behavioural therapy?
Resource therapy is based on looking at the origin of the problem, where there will be a part, there's nothing that we do that doesn't have a cause. And so if we're having an emotion that we don't like, if we're having a behavior we don't like, if we have conflict, there's a reason for all of that. And where cognitive behavioral therapy can be quite effective in moderating symptoms, it doesn't really look at the cause. Cognitive behavioral therapy doesn't look at the past. It doesn't look for causes. Cognitive behavioral therapy looks to train new behavior and to reframe. And that's good. But resource therapy looks at exactly what part of a person is causing a problem. And when that part is addressed, it can be freed to become a more integrated part of the personality. And there's a more complete change rather than just being able to get through something better. It becomes not a problem at all because the cause has been addressed, and the part that was either traumatized or having a negative behavior doesn't have